purpose of this video is to answer some frequently asked questions. I find myself answering most of the same questions over and over again, so this is just to help someone when they've unpacked their new lights, or if they're even thinking about getting lights and they have these questions. First question, what pads go where? And the answer is it mostly doesn't matter. The pads all come in different sizes so that you have versatility in where you put it on your body. But the one pad that you really want to make sure you use properly is the eye mask. And this eye mask goes obviously just over the eyes. You can put the eye mask anywhere else, but it's the only one you want to put over your eyes because infrared is not in this particular pad. This one's a good one. How often can I do lights? So here's the answer. You can do, say, 20 minutes of lights on your wrist, and then you can move it immediately and do it on your elbow, and then you can move it immediately and do it somewhere else. But the point is you don't do more than 20 minutes at a time over the same area. So you can move the pads around, and the answer is you can do lights 4 hours in between. So you can do your wrist at 12 o'clock and at 4 p.m. and at 8 p.m. Okay. What are all the different frequencies for? This could be an hour, so I'll just make it brief. There's different healing frequencies that resonate with different tissues in our body. We know that our tissues, some tissues heal with certain frequencies, so the system has several different frequencies, and there's a couple different kinds of frequencies that it uses. It uses some physical frequencies and also frequencies called the solfeggio frequencies. There's some auto settings that I highly suggest people start off with and don't get all crazy about what frequency to use. So there are 3 auto settings, and it's A, B, and C. A is physical frequencies, so those are just, we call it lazy man pain. It cycles through all 7 frequencies, so just put a pad on and turn it on A for your pain. B utilizes the relaxation frequencies, the ones that resonate with your chakras, so they're very relaxing, de-stressing. So B, it's a good time to use B at bedtime. B is for bedtime. And then C is a nice combination of both, when you need some de-stressing and relaxing, but you also want to use some physical frequency healing. Okay, what are the benefits of the eye mask? Why do we have lights over our eyes, people ask. Anyone who's ever used lights over their eyes knows how incredibly relaxing, incredibly quick that happens. So the reason is because the light penetrates through our optic nerve, gets in our frontal cortex, a lot of blood flow going there, and it just has an incredible relaxation purpose. In addition to that, there's a lot of benefits to bringing healthy blood flow to your frontal lobe, where your decision making and your mental acuity lies and your focus. So the benefits are definitely just, for your brain, and also will help your sleep and your regulate your circadian rhythm. When we give ourselves light over the eyes during the day, we sleep a lot deeper. Hi, can I use them on my pets? Of course you can. Pets love lights, and pets, horses, whatever kind of animal, they receive energy so much better than humans, because they don't have any baggage. They're not thinking about the mortgage or the phone bill or whatever, and they just respond so well to lights. So here's the rule of thumb for pets, and you'll find that everyone talks about how the cat comes when the lights come on, or the dog wants to lie by you when the lights come on, because they love that energy. Just you can put a pad over wherever, just for health. They don't have to be hurt, but let them decide when they want to be done. That's all you got to do, because they know intuitively when to be done with the lights. They don't need a timer. I've had some great results with my Shih Tzu and lights, by the way, so if anybody wants to talk about their pets, let me know. Can I travel with my lights? I hear this all the time. The answer is absolutely yes. You can travel with your big system, you can travel with the travel system, you can carry it on, you can check it. I've done both. I always just put an InLight Wellness brochure in the bag in case someone at security wants to know what it is, and they can open it up and read that it's a medical device. And once you have lights, you really don't want to leave home without them. Okay, then I get lots of questions about, well, how would I do lights if I wanted, if I wanted my acne or anti-aging, what would you do? And personally, what I do for anti-aging is I just, use the eye mask all the time, just because, so that really helps with fine lines and what have you. And then you can just take another pad and just hold it over your face or underneath your neck. And that's what I would do for skin. Let's see, what else? For brain health, I just think it's important to have circulation in your brain at all times. So this system's amazing. It's FDA cleared to increase circulation, so why not do that for your brain? So all I do is the eye mask, and then I Velcro over my head, this pad, and then I take one of the square pads or the local pad and I put it in the back, and I do auto A for 20 minutes. I really try to do that 3 times a week because I just think it's really important for the brain, and why not? I have the lights. If you have the lights, put it on your brain for sure. It's just a nice little treat. What if you have a stomach ache? Well, in my house, if someone has a stomach ache, we just put the pad over the stomach and turn it on auto A. You could do auto B for relaxation, or you could even do C, any of the auto settings. So you get the idea. Just put a pad on it and turn it on. How do you clean your pads? Well, I use an antibacterial all-natural wipe that I just clean the diodes off after each use. Really simple. One thing people ask, like, should you do the eye mask at night? I choose not to. Most people don't have an issue with lights in the eyes at night, but there's a possibility that you could kind of wire yourself, and you wouldn't want to do that right before bed. So at nighttime, when you're doing like the bedtime setting, you just put pads wherever. It doesn't matter, because your body just absorbs those frequencies. It doesn't matter where the pads are to relax your body. And the final question I wanted to go over is, people say, well, where can I get more instructions? Like, people are so hungry and they want to learn more and more. Well, first of all, there's over 5,000 studies of National Institute of Health, PubMed, Mayo Clinic. All you got to do is search low-level light therapy or photobiomodulation or just light therapy, and you can even pair it with whatever condition you're looking for. So low-level light therapy and osteoarthritis, etc. So there's just lots of information on light therapy itself. And then if you want to be actually more trained on the InLight Wellness system, we do have certification programs, and I'm happy to share that with you. If you just send me an email or give me a call, and I'm happy to give you your options as far as some online classes or even in-person classes. So thank you. I hope this answers most of your questions, and if it doesn't, please jot them down and send me an email or give me a call. And